Hello guys, welcome back to Clinically Clear. So today let's cover about family and social medicine. So a family is a group of biologically related individuals living under a common roof, same roof. So this is not room, this is roof, living under the same roof and using a common kitchen. Okay, this is a family. Family forms the most basic unit of society. It is the strongest form of social cohesion. It is a mix of a cultural unit, biological unit, and a social unit. Biological because they all have the same gene pool, similar gene pool. Cultural unit, they have the same cultural beliefs. Social unit, same social system. Simple, done. Then coming to family cycle. Family cycle basically it starts with marriage. From marriage till the first child being born is known as formation. From the first child being born till the last child, it could be the second child, the third child, fourth child, whatever it is, that is known as extension. From the last child being born till the first child leaving the house, that is complete extension. Understood? Last child being born till the first child leaving the house. From the first child leaving the house till the last child leaves the house is contraction. From the last child leaving the house till the first spouse death. Marriage between two people, right? So one person dies, till then it is complete contraction. From the first spouse death to the second spouse death, the sole survivor, till that person dies, then the family is said to be dissolved or dissolution. So formation, extension, complete contraction, and dissolution. Okay. Types of family, only one person is living. Proton, one person and parent. There is no marriage here. One person and a parent. Electron family. Nuclear family is the most basic form, unitary or elementary, where you have a married couple with or without dependent children. Okay, there are no grandparents. So, if this nuclear family is less than 10 years old, it is said to be a new family. Three generation family, common sense, grandparents, parents, and children. Joint family is when multiple married couples, you have multiple married couples in the same house, same roof, same kitchen, and they all have common finances, common property, common kitchen, common family purse. Males are all blood relatives. Females are the sisters, wives, and the daughters of these males. Understood? The senior most male is considered as the head of the joint family. This is about joint family. Conjugal family is where the family structure is more focused on the emotional bonds rather than duties of each individual. Communal family is where there is division of labor. Every member plays a role in the household management. This is communal family. Dysfunctional family is where you have a lot of abuse, a lot of conflicts. Consanguineal family, you have a consanguineous marriage as the foundation of family. So these are all the various types of family: proton, electron, nuclear, three generation, joint, conjugal, communal, dysfunctional, and consanguineal. Role of family in health and disease. Consanguineal marriage, there is increased risk of congenital disorders. Disorders like diabetes, hypertension, hemophilia, schizophrenia, color blindness, these all have familial inheritance. They can be passed down from one generation to the next. What are broken families? When there is divorce, separation of the two parents, or both the parents death of both parents, then the family is said to be broken. Or if it is a problem family where because of poverty and poor socioeconomic status the family lags behind the rest of the community, then the parents are unable to meet the physical and emotional needs of the children, so the children end up in increased, they do a lot of criminal activity, addiction, antisocial behavior, they get into prostitution, they'll show growth retardation. All these are increased, there's an increased risk of all this happening when it comes to broken families and problem families. Understood? So this is how family can also affect health and disease. Functions of a family, common sense. Residents, they all live together. You can have patrifocal resident, matrifocal resident. Patrifocal residence is when the wife comes to the husband's house. Matrifocal is when the husband goes to the wife's house. Economic function, there is inheritance of property from one generation to another. They raise the children, they take care of the dependent people who are the aged people, the sick people, the pregnant women. These are all the dependents, taking care of them. The family has a societal role, they have a social role, they have a family status. There's a status for that family, there's a family name, all there is society. Behavior development and personality formation of the members of the family, and division of labor. I told you, right? Communal family, there's division of labor. These are all functions of a family. It is just basic common sense. Next, coming to cultural factors affecting health. In India, we have various diverse cultures which all have they all have various, superstitions, stereotypes, and stuff like that. Coming to some cultural factors regarding the concept of disease etiology. Some people think that TB is because of sins of past life. Sexually transmitted disease is because of sexual intercourse with lower caste women. Chicken pox is because of the wrath of God, and epilepsy and mental health disorders are due to spirits taking over them. These are all some cultural practices when it comes to the concept of disease etiology. Environmental cultural practices, like when it comes to water supply, people in villages will use the same well, same river. They'll use it for drinking water, they'll use it for bathing, they'll use it for washing animals, washing utensils, washing clothes, everything. They'll use the same water supply, so it gets contaminated. When it comes to sanitation, many of them don't have toilets, they'll do open defecation in fields. They'll use cow dung, they'll dry it and they'll use it as fuels. Solid waste is allowed to decompose and it is used as manure. All these are sanitation cultural practices. When it comes to housing, they'll have kacha house, they won't have a tiled roof, no separate kitchen in the house, poor lighting, poor ventilation, no cross ventilation, damp house. These are all the housing standards when it comes to some cultural factors. So that's how cultural factors can affect the housing standards. Next, coming to mother and child health. Mother and child health, you can have good practices and bad practices. Good practices like oil bath, sunbathing, massage, all those are good practices. Bad practices are discarding colostrum, giving honey to newborn babies, applying cow dung on umbilical cord. All these are bad practices. This is regarding mother and child health. Regarding sex and marriage, there is a custom of child marriage in some communities, polygamy versus polyandry in some communities, premarital sexual intercourse is considered as taboo in some communities, and menstruating women are considered impure. They are not allowed to enter temples and pray in temples. That is in menstruating women. So the last, coming to personal hygiene, some people don't use toothbrush, they'll use neem stick, they won't use toothpaste, they'll use ash powder, they'll use some barbers will not sterilize the blades and the scissors. These are all some cultural practices regarding personal hygiene. Dietary, Muslims will not eat pork, Hindus will not eat beef. There's a concept of cold food in India, hot food in India. Like cold food is curd, hot food is eggs. These are all how cultural practices, cultural beliefs can affect health and disease directly or indirectly. Understood? Last, coming to acculturation. Acculturation is basically mixing of cultures. Cultural practices from one society diffuses into other societies. Understood? Best example is how India has adopted a lot of Western cultural practices. How do these cultural practices diffuse? Through various channels, media, through industrialization, through education, through trade and commerce, through migration. So various ways these Western cultural media, such as in movies, industrialization, education, trade, migration. So in these channels, cultural practices from one society will diffuse into other societies. Understood? Then coming to barriers. Barriers you have, it can like, what are the barriers for this acculturation? Basically, taboo. Some people consider cultural practices from other societies to be taboo. They'll be narrow-minded. They will not have any adaptability. They will not adapt to other cultural practices. They will have a sense of superiority that, my culture is more superior than other culture. Why should I listen to them? Why should I adopt their practices? These are all barriers to acculturation. This is the channels of acculturation. Now, just because there is diffuse of cultural practice, it need not always be good, it need not always be bad. Best example, Western culture, some bad practices are smoking, alcohol, junk food, sedentary lifestyle. But some good practices are focus on ethics, increase literacy, more focus on scientific medicine, less of superstitions and cultural taboo, etc. So these are all. This is acculturation. It is a 3-mark topic. No need to go too much into detail. That's it for family and social medicine. Thank you for watching.